Hello everyone. What we're going to do today is give a physical examination to one of our canine patients. Previously we've done a video doing one of our feline patients, but there are some differences. And so as I work through this examination today, I'll talk about some of the things that we're doing and perhaps things that we might do in a dog that we wouldn't be doing in a cat. But the goal is the same, to be very thorough, ask the owner about the history, and just go from one end to the other in an organized fashion and get the physical exam taken care of. So first of all, we'd start with the weight, and with our dog patients, for the most part, we use our lift scales or lift tables because we can get a weight and also get them up in the air without all the stress and strain to our backs. So that is one thing. In most instances, we don't use this table for our cats, although we could, but the benefit to us is we get the weight, she's 46 pounds, and we get to raise her up without having to lift. Most of the time on well visits for dogs, we will take the temperature. Obviously we'll take it if they're sick. And in our cat patients, just for the stress level on well visits, most of the time we don't take the temperature just to minimize their stress. So there's a difference right there. Most dogs, again, just because they've got bigger anatomy, we will go ahead and take the temp. So oftentimes as we're waiting for the temperature to register, I'll palpate or cruise through the tummy or abdomen. I want to make sure that the organs are the right size and right location. And again, as with our feline patients, I like to talk through the exam so that the pet owner knows what I'm doing and what I'm looking for. Normal temperature range is pretty wide, 100 to 103 degrees. She is at 100.8, and that's normal. So again, to be thorough and organized, I usually will start at one end and go to the other, and always just kind of greet the patient, so to speak, or kind of get them used to me with my hands on them, give them some nice stroking here, starting with the ears, just kind of a quick overview, quick eyeball look, and then I'll grab my otoscope and take a look further down in. Again, most of the time I'm verbalizing this to the owner so they know what I'm looking for and what I'm checking for. These are nice, beautiful, clean ears. Now, for the purpose of the video, I won't turn the light out, but for my eye exams, I'm turning the light out and starting at the back of the eye where the retina is, coming out through the lens and the outer structures. Again, telling the owner that I'm interested to make sure that there's no sign of glaucoma or no sign of cataracts, or on the outer part of the eye there's not a scratch, those types of things. So again, both ears have been examined. I'm working over the second eye. And again, commenting to the owner about how good things look. Oftentimes, if I find something wrong, I'll wait till the end to tell the owner. I don't want to get them upset in the middle of the exam. And then all the normal things get kind of passed over, and they focus all on just the problem at hand. So oftentimes, if I find a problem or problems, I'll wait till the end and kind of summarize it. Beautiful teeth here, a little bit of tartar back here, not too bad. And that's a common tooth to have a lot of tartar buildup. The salivary duct opens right over top of that tooth. A lot of saliva is cascading over the tooth. And so that's a tooth that's going to get some tartar buildup. And ditto back here too. And we get a good look at the oral cavity. Then I move down to the legs and just kind of flex and extend. Comment about the name of the joint to the owner's shoulder, elbow, wrist, and just flex and extend just to make sure they're comfortable. There's no crunching or grinding or grating. Then I just move on down the body. I've started recently commenting to owners that I'm also checking for lymph nodes. I've always done that, but lymph nodes are normal if you can't feel them. And so when I'm working over dogs and cats, I comment to the owners that the lymph nodes feel good. Obviously, if they don't, I'm going to mention it to them, but I just want them knowing, again, all the body systems that I'm checking. And also, During the exam, I'm usually always just trying to get my hands on them, checking for lumps and bumps, making sure that we don't have any ticks. Sometimes it's very difficult in some of these longer coated dogs to feel the ticks are present. So that's where the owner's history or the owner's having checked them out before I came in helps out a lot. Hip, knee, and ankle in the back, again, same thing as with the front legs, just a lot of good flexion and extension, making sure they're comfortable, and again, talking through the exam with the owner so that they know exactly what I'm doing. Listen to the heart and lungs. I want to make sure there isn't a heart murmur. I want to make sure that the rate and rhythm are good, and then obviously that the lungs are clear. I check the pulse back here to make sure that the femoral pulse matches with the heartbeat. Good. Sounds great. Always running my flea comb through as well. Even if it's the middle of winter, I'm getting out the flea comb, making sure that we don't have trouble. Fleas are easiest found back in here or up by the neck and head. That things are negative. Kind of crouch down and get a look under the hood, so to speak. Look at the tummy, the groin area. Just make sure that the skin is nice and healthy. In the armpit and groin where there's a lot of friction, make sure that these areas don't have crusts and scabs or any sign that the dog's been licking. And then one thing, difference-wise, that I will do in most dogs, unless they're teeny tiny, I will do rectal exams. In the males, obviously, we're checking prostate, making sure that there are no rectal tumors. And in the female, they don't have prostates, obviously, but rectal tumors occasionally will crop up. And I'm always checking, making sure that everything's clear. This is also a good time to get a stool sample to check for intestinal parasites. And so I'm always collecting that too, and then commenting to the owner that, hey, we got a stool sample to check for these worms, if you will, or intestinal parasites, because that is something that can cause vomiting and diarrhea troubles or potentially be passed on to people. And she felt good in there. Everything felt normal. The other thing that we'll do on our dog patients is once a year, we get a blood test called a blood parasite screen. It checks to make sure that the dog has remained negative for heartworm, which is carried by mosquitoes, but three other parts of the test check for tick-borne diseases, one of which is Lyme's disease and a couple other blood parasites that ticks carry. So we don't need too much blood. We just get a little sample from a vein in the front leg. Don't need too much. This test just takes 7 or 8 minutes, and most of the time we have this done before the owner leaves. Ticks have been a trouble for us this year, and so we want to make sure that, especially on Lyme's disease, that we're negative before the owner leaves. On some of our positive cases, then we still have the owner here where we can talk with them about signs or symptoms and how we might want to manage their case. So this is our typical dog physical exam. Again, kind of an organized approach through the body systems, always verbalizing to the owners what's going on. And again, if I do find troubles, I'm kind of summarizing at the end what we found and what we need to do, and then answering the owner's questions. So here at Bakerstown Animal Hospital, this is a physical exam we typically give our canine patients. And we have a nice, healthy patient here.